Kalimera, Yassas. I learned this recently. Thank you for the invitation and thank you for the nice presentation and to be here. I must say I'm very glad to try to help, and congratulations to ΕΛΛΟΚ and its whole organization gathering efforts to join this idea to prevent cancer and to treat better our patients. You know, I will present some ideas, our 3 ideas based on our experience. I've been working on ECL, ECHO, with the communities, with the cancer leagues, and overall I'm working on HPV and vaccines for 30 years, even before some of you were born. And it's something interesting because we have accompanied the evolution of all of this, and we are very proud to know nowadays some perspectives, what can be done, what we have as the tools on this prevention that we can prevent the cancer. And the idea to prevent the cancer, as you heard before on the European Code Against Cancer, and we know it for many years, half of the cancers, 50% of the cancers, can be avoidable, preventable, and we know the guidelines how to proceed. We have also to have some luck, because sometimes it's not enough, but we have those guidelines. But for some cases, and cervical cancer, we can avoid almost 100%. So it's an amazing idea. We can avoid the cancer 100% of cases and turn it as a rare, very rare disease. Of course, because we know by research that there is a virus that is linked to this cancer. For that, we need political will, we need resources, we need the commitment of our society. Everything is out there, and as it is for your ideas, I would like to say more on this. Think on this, on the general ideas on prevention, and you should retain this idea. Prevention is the best way to avoid a nightmare to have a cancer. So we should think on this because it's the best way. We have 2 ideas, classics, the primary and the secondary prevention. And do we have some tools? Yes, we have tools. How? How can we working like the marathon old classic battle with 2 arms? How can we avoid the cancer like cervical cancer and other HPV-related cancers? Those 2 arms or tools are out there. We have screening, we have vaccination, over a field of knowledge and awareness of the population. So we have the tools, we can achieve this if we implement those tools in 100% of the cases. We at the ECL and after the ECHO, the European Cancer Organization, we have tried many years ago. You can see over here our proposal in 2020 to have some guidelines that are very easy to implement. The gender-neutral vaccination, which is what we should think, the screening for over 70% of the population, and the offer of cancer treatment and equitable way to all the population. And of course, the community and professional awareness is a must. So the ideas are out there for many years. We can see similar ideas on WHO proposal, where it's very important to think on the examples that exist nowadays, and those examples can give us a lot of information and how to go. The example of Sweden or some of other Nordic countries is a good example. We have done for The Economist a report on Sweden. It's an excellent example and amazing example. But in our opinion, I'm not sure if it's a good example for most of the other countries, especially for the southern of Europe, because it's a perfect example with everything can be done in the right way. So I can show you other examples, and I can also tell you that I enjoy very much more to unwrap an orange than an apple, the Portucali orange. So Portucali, which Portugal, is a good example for all of you because it's an example of a real-world example of Southern Europe, not so organized as Sweden, but we can do good things and we have indicators. It's very important to have indicators of success. So Portucali can be a good example for all of you. And we have thought on this, why is Portucali? How have we been working on this? And I told you, we have our vaccination HPV approved from 2009, which is long ago. Our molecular-based screening from 2016, so it's a long run, but we have also worked in other ways. One is the credibility of messengers. You should have messengers with credibility that our communities and health professions believe on that. The health professionals' engagement, a national consensus, a national health system with efficacy, and overall the political will and decision. It's very important. On the work with the communities, we have done a lot of work on the health professionals, the community, with cancer leagues, with all the organizations we could get together just to have this field where the plan could work. And also the credibility of messages is a key, and even introducing new ideas like self-sampling, which is now. Also, we tried to understand the knowledge of our health professionals and future health professionals to understand the gaps on their knowledge and to proceed. Also, we had the help of some friends. You can see over here Harald Zurausen. He was the HPV Nobel Prize. And those credibility of the message are key issues in our procedure. Also, a key element is the national consensus on vaccination, on screening. We have done this as a key. ΕΛΛΟΚ can be a good field to work on this. Also, our national health system is, besides all mistakes and problems, it works very well on vaccination. We have the health centers. Our health centers are a huge network with doctors and nurses, and they work pretty well, especially on the health care support. And our population is keen to be vaccinated. You can see here some reports on the COVID-19 vaccination, and the idea is everyone was vaccinated. We believe on vaccination for many years. Our communities do believe in that, and it's something, it's a golden mine we cannot avoid, and you also should work on this because vaccination is, again, one of the best ways to avoid a nightmare. And of course, other countries, you can see over here at Croatia, do look at Portugal as a good example as what we can do on the real world. And I will show some indicators that I've shown at European Parliament, and those indicators demonstrate what I'm saying now. And those indicators are this. Vaccination over 90%, which is year per year per year, always indicators of excellent procedures, excellent way to go, and our community do accept. And screening, not so bad. It has floating numbers, but it's something is working. It's all over the country. And also, I could say those are our numbers, but at the European level, we have indicators. This is, a new one is coming, and again, Portugal is number 2 on the indicators of policy on screening, policy on cancer screening. So those are examples where we can work, and those are examples, as I told you, to show you Portugal as real-world example. So I would like to end with 2 ideas. Yes, is it a HPV cancer-free Europe possible? Portugal says yes. I hope Greece will join the club. And for us, Greece is not only football, not only the birth of civilization, but also other things. Other things, 400, 500 years ago, one of the most important medical doctors we have on our history, Amatus Lusitanis, he went to Dubrovnik, and after his last years were on Thessalonica, or Salonika. He died out there, so probably is out there. So if you have any report of Amatus Lusitanis at Salonika, send me, I would like to have it. Because he is considered one of the first European doctors. He had a lot of clinical reports, and the last books of him were done at Salonika. So to end up my communication and lecture, I would like to say, for us, Greece is not only birth of civilization, but what we are seeing with ΕΛΛΟΚ, and your minister told it, it's a civilized way to proceed on cancer prevention and cancer treatment. It's together all efforts, together all wills, and do it in a civilized way, and knowing the examples who can help you and the real world examples. Thank you so much.